Good afternoon, Leslie. How are you doing today?
I'm doing good.
Good. So my name is Charity. I'll be the student physical therapist working with you today. So what we're going to be doing today is what's called a systems review. So we're going to go through a couple of tests just to make sure that your joints don't hurt, that your muscles are working, that your nerves are working, and we're just going to kind of run through everything from the head to your torso. Does that sound okay with you?
Mm-hmm.
All right. So I'm going to start with your vitals for the purposes of this assignment. Her heart rate would be, for a healthy average adult in mid-20s, 55 to 75. Average blood pressure for a healthy adult is 120/80. And then respiratory rate is going to be 12 to 18 breaths per minute. So next what we're going to do is move on to a postural observation. So can I have you take your shirt off for me?
Mm-hmm.
Awesome. And then when you're done with that, go ahead and stand up facing me. All right, so during this postural assessment, what I'm looking for at the front is to see if her shoulders are even, which they look pretty much even. If anything, maybe this right shoulder is just a little bit depressed, but that's okay. Have your arms by your side. There you go. Awesome. And then she has good symmetry here too. So now go ahead and face the front. I'm gonna look at you from the side now. So from the side, what we're looking for is her ear in line with her glenohumeral joint or your shoulder joint here, and it looks like she's got good posture, which is awesome. And then go ahead and face away from me. And then here on this posterior view, what we're looking for is where the medial borders are in reference to the spine. So I'm gonna go ahead and put my hands on your back. Is that okay?
Mm-hmm.
All right, they're a little cold. So her medial borders are about out here, and I can fit more than a hand's width between each medial border and her spine. So I'd say that her scapula are a little bit protracted, which is totally normal for a student. And then her inferior borders are actually relatively flat on her spine, which is good. So that means her serratus at least aren't weak enough to have scapular ringing. Awesome. Okay, you can go ahead and have a seat. So now that we've done the postural assessment, we're going to do some functional demonstration tests. So go ahead and demonstrate to me how you would put your seatbelt on, whether you're in the driver's seat or the passenger seat. Awesome. Any pain with that?
Mm-mm.
And then can you do it with your other arm for me? Nice. Any pain with that?
Mm-mm.
Okay. And then what I'm going to have you do is reach behind you and scratch the top of your back. Good. And then can you do that with your other arm for me? And then can you reach up from behind and scratch your back? And then the other arm. Any pain with any of that?
Mm-mm.
Awesome. So with the functional demonstration test, we're just looking for if they have any pain or any poor movement patterns with normal everyday activity motions that we would be doing, like putting your seatbelt on or scratching your back. And she didn't have any pain, so that's good. Okay, next we're going to do what are called active range of motion clearing tests. So basically what we're going to do is I'm going to have you go into as much range of motion as you can in specific directions, and then I'm going to apply a little bit of pressure to see if there's any pain. Does that sound okay?
Mm-hmm.
All right, so first we're going to do flexion of the neck. So I'm going to have you bring your chin to your chest for me. Awesome. And then I'm going to stabilize here in your T-spine on your back. I'm going to apply a little bit of pressure through your head. Any pain with that?
Nope.
Good. And then look up towards the ceiling for me as far as you can. Can I touch your chest?
Mm-hmm.
Awesome. Any pain with that?
Nope.
Good. And then I want you to bring your right ear to your right shoulder. That's your left, but that's okay. Any pain with that?
Nope.
Good. And the other way. Any pain there?
Nope.
Okay, face that way. Any pain with that?
Nope.
Good. And then again towards me. Any pain with that?
Nope.
Good. All right, next what we're gonna do is I'm gonna have you raise one arm up overhead. Awesome. And then I'm just going to come down here. Any pain there?
Nope.
And then can you bring it out to the side? Good. Any pain there?
Nope.
Good. All right, and then can you bring your arm up to shoulder height? Good. And then bring your hand all the way up toward the ceiling. Awesome. I'm gonna apply pressure here. Any pain there?
Mm-mm.
And then drop your hand down. Any pain there?
Nope.
Good. And then you can relax your arm down by your side. Or actually go ahead and flex your elbow for me. Any pain there?
Nope.
Okay, and then extend it as far as you can. Any pain there?
Mm-mm.
And then flex your wrist. Awesome. Any pain there?
Mm-mm.
And then drop your hands down. Any pain there?
Nope.
Awesome. And now we're gonna come to the other side. So bring the arm up overhead. Good job. Any pain there?
Nope.
Out to the side. Good. Any pain there?
Nope.
Good, and then we're gonna come, oh yeah, bring your arm up here again. Down just a little bit for me. Good, and then raise your hand up towards the ceiling. Good. Any pain there? Any pain there?
Nope.
And then bring your elbow back for me. Good. Awesome. All right, and then wrist up. Good, and down. Awesome, and then we're also gonna do palm up too. I'm gonna apply a little bit of pressure here. Any pain?
Mm-mm.
And then palm down. Sorry, your watch is kind of... Any pain there?
Mm-mm.
Good, and then we're gonna do extension on this side. You lift that one up. Any pain there?
Mm-mm.
Okay, and then we're gonna do palm up here too. Any pain?
Mm-mm.
And then palm down. Any pain?
Mm-mm.
Awesome. Okay, all right. Now that we've done all the clearing tests and you didn't have any pain, we can move on to what are called dermatomes and myotomes.
Mm-hmm.
So essentially what we're doing with these tests are making sure that the nerve roots that are coming out of your spinal cord are intact and properly innervating muscles and fascias of your skin. Does that sound okay?
Mm-hmm.
All right, so first we're going to start with myotomes. We're going to test your muscles first. So we're going to start with C3, which is going to be bringing your ear to your shoulder. So choose which side you want to start with. Good, and then hold, don't let me move you. Hold, 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 hold. Good, and we're gonna go to the other side. Hold, don't let me move you. Hold, 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 hold. Good, so that was C3. C4, we're gonna have you raise your shoulders up towards the ceiling. Hold there, don't let me move you. Hold, 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 hold. Good, that was C4. C5, we're gonna bring our arms out to the side like this. I'll come behind you. Hold, don't let me move you. Hold, 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 hold. Good. And then go ahead and flex your elbows up for me. Good. Hold, don't let me move you. Hold, 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 hold. Awesome. And then you can leave them there, but I want you to hold. Yeah, bring them down just a little bit. Hold, don't let me push them in. Ready? Hold, 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 hold. Awesome. So that was C7. This one was C6. For C8, we're gonna do your thumbs. So go ahead and give me 2 thumbs up. Awesome. Hold, don't let me move you. Hold, 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 hold. Good, that was C8. And then for T1, I'm gonna have you spread your fingers out all the way. Good. And then put my fingers here. Squeeze, don't let me pull my hands out. Ready? Good. All right, so all of your myotomes are intact bilaterally, which means that your nerve roots are working well and innervating the muscle. Okay, next we're gonna do dermatomes. Let me grab my tools real quick. So we're just gonna be testing if you can feel this on your skin. So I'm gonna go ahead and let you know what it feels like. Nice and light, right? Not painful. I'll give you a test strip really quick in just a second, but basically each time I touch you on either side with these, I'm gonna ask you where you felt it and if it feels the same. Is that okay?
Mm-hmm.
Let's go ahead and close your eyes. So that's what it's gonna be like. That was your test.
Mm-hmm.
So we're gonna start with C2. Does this feel the same as this?
Yes.
And where did you feel that?
Back of neck.
Okay, C3. Does this feel the same as this?
Yes.
Where did you feel that?
Above my collarbone.
Okay, C4. Does this feel the same as this?
Yes.
And where did you feel that?
On closer to my shoulder, but still my collarbone.
Okay, awesome. And then C5. Does this feel the same as this?
Yes.
Good, and where did you feel that?
On the outside of my elbow.
Okay, and does this feel the same as this?
Yes, on my thumb.
Awesome. Does, C7, does this feel the same as this?
Yeah, my middle finger.
And C8, does this feel the same as this?
Yes.
And
Pinky.
then, awesome. T1, does this feel the same as this?
Yeah, the inside of my elbow.
Good, and T2, does this feel the same as this?
Yes, my armpit.
Awesome. All right, you can go ahead and open your eyes. So again, those are intact bilaterally. You had the same sensation on both sides and you knew exactly where it was, so that's a good sign. The last 2 things we're gonna do are reflexes. So I'm just gonna check really quick what's called the Hoffman sign. It's basically gonna make sure you don't have any kind of injury with your brain or your spinal cord. So go ahead and you can rest your, well actually, I'll go ahead and get you, because we need it anyway. Go ahead and rest your arms down. Yeah, let your hand relax here. I'm just gonna kind of flick your finger. Awesome, so that's a negative sign, which is good. If it was positive, your hand would bounce a couple of times. We're just gonna check this side as well. Awesome, that one is also negative. Perfect. So both of those are negative, which is good. So next what we're gonna do are other reflexes that are gonna be for your C5, C6, and C7 nerve root. So for C5, we're going to test the reflex at your biceps tendon. So I can already feel it there, but go ahead and flex your bicep for me just to make sure I'm on it. Good. Can you go palm up for me? There you go, there it is. All right, so I'm gonna just gently tap the hammer onto my finger. You can look away, it might help a little bit. Awesome, okay. So that was C5. Then I want you to make a thumb and then kind of pull your thumb up. Good, I'm just gonna follow up to right there. Awesome, and relax. This is C6, the brachioradialis. Awesome, okay. Those are all good reflexes. And then we're gonna do C7 next, which is going to be your triceps reflex. So go ahead and relax your arm down here for me. I'm just gonna kind of tap the back of your elbow. Awesome, okay. So for your left side, I would say that's a 2+, which just means that your reflexes are rather normal, which is a good thing. And then we're gonna do the same thing on this side. So we're looking for that biceps tendon for C5. Awesome, thank you for flexing for me. Awesome, and then make that thumb again for me and pull it up. So you can find your brachioradialis. C6 here, and relax. Awesome, and then let me have your arm again. C7 for triceps, relax your arm. Good. Awesome. And then for your right side, I would also say that's a 2+. So after doing your systems review, it seems that everything is pretty normal. Your posture had a few deviations that we can work on with some strength training, but other than that, you're looking good.